In your health news tonight, taking a breath for breast cancer, patients who face an increased risk for a heart attack.
It appears that breathing in while undergoing radiation could have a long-term impact to lower that risk. News 8's medical reporter Jocelyn Memento with more on what's being done now at UConn Health to make treatment less toxic for breast cancer patients.
When Andree Gervais was diagnosed with breast cancer,
just a little spot, about 4 millimeters wide.
her treatment included a lumpectomy, chemo, and radiation. But getting that dose of radiation required an added step, albeit a simple one.
2 or 3 breaths and you're done.
She's talking about deep breath inspiration.
The idea of the deep breath inspiration is to change the shape and size of the chest wall so that the breast is separated from the heart to a greater distance than it would be if you were breathing normally.
Radiation oncologist Dr. Robert Dowsett at UConn Health says the novel technology aims at reducing the long-term effect of radiation exposure on a breast cancer patient's heart.
There's evidence that even low-dose radiation to the heart, years down the road, and maybe a decade later, can lead to higher risk of heart attacks.
As Andree demonstrates, it begins with putting on special goggles to help guide her to inhale correctly.
You would inhale, you'd watch the bar rise, you had to get the bar inside a box. So when you would exhale, the bar would drop. When you would inhale, the bar would rise, and you would hold your breath. You would try to keep the bar inside this box.
So when the radiation is delivered,
Our radiation beams come from this orientation, this way, and also a second beam coming that way.
there's more space between the edge of the heart and the breast wall. This is a scan of Andree breathing in and out normally. This one is during deep breath inspiration.
And that small, half an inch to 3/4 of an inch distance that we can create between the chest wall and the heart gives us a lot of room to get the radiation beam in.
That small distance, says Dr. Dowsett, can make a big difference.
If your heart attack risk was 5% in your lifetime, but we doubled it to 10%, well, you still have a 90% chance of doing fine, but there's 5 people out of 100 that will have heart attacks that they didn't have to have them.
Patients with lung and abdominal cancers are now also benefiting.
It's not going to make a difference tomorrow or even 2 years from now. So we're trying to think of the long term for all the patients.
And it keeps my heart muscle safe.
At UConn Health in Farmington, Jocelyn Memento, News 8.